Mr. Vice President, I'd like to ask you about healthcare because obviously this pandemic has exposed many weaknesses in healthcare. In your platform, you'd extend medical benefits to DACA recipients, but what about the workers who have no protection, specifically farm workers now deemed essential to make Americans sure that they have food on their table? Should undocumented immigrants also be able to get subsidized healthcare?
If they are working in the United States of America and they are paying taxes, they should have access to health care. They should have access to what everybody else has access to.
This
Most
is every
important thing to do.
undocumented worker?
No, it depends. Not all undocumented workers are working. You say on every undocumented worker. Every person in the country, whether they're undocumented or documented, should have access to a vaccine if and when it occurs, should have access to testing and treatment and hospitalization if it relates to the virus. And that should occur, period. It's in the interest of everyone that everyone be taken care of, and everyone should be able to be eligible for that.
So just to clarify, you're saying that if you are undocumented, you would be able to get a vaccine for free, subsidized?
Yes. Yes.
I'd also like to ask you this. This pandemic has exposed, as I've mentioned, so many weaknesses in the healthcare system. The most vulnerable, often Black and Brown communities, have been handling much of the financial burden. Before the pandemic, you were against comprehensive single-payer system. Now, if Medicare for All came across your desk as the pandemic has hit so hard, would you veto it?
It's not going to come across my desk.
And I've asked other candidates this kind of question, veto question. Let's flash forward. Your president, Bernie Sanders, is still active in the Senate. He manages to get Medicare for All through the Senate in some compromised version, the Elizabeth Warren version or other version. Nancy Pelosi gets a version of it through the House of Representatives. It comes to your desk. Do you veto it?
I would veto anything that delays providing the security and the certainty of health care being available now. If they got that through and by some miracle, there was an epiphany that occurred, and some miracle occurred that said, okay, it's passed, then you got to look at the cost. I want to know, how did they find the $35 trillion? What is that doing? Is it going to significantly raise taxes on the middle class, which it will? What's going to happen? Look, my opposition isn't to the principle that you should have Medicare. I mean, everybody, health care should be a right in America. My opposition relates to whether or not, A, it's doable, two, what the cost is, and what the consequences for the rest of the budget are. How are you going to find $35 trillion over the next 10 years without having profound impacts on everything from taxes for middle class and working class people, as well as the impact on the rest of the budget?
Look, the pandemic has not only torn through our nation, devastating families and wrecking economies, it's exacerbated some of the worst inequities. I'm going to fight for health equities, but you don't need, the quickest way to get that is for Black and Latino Americans to have access to the Obamacare with a public option. That's the quickest way we can get everybody covered.
But hasn't this pandemic and the tsunami of layoffs shown the limits of private health care that is tied to employment?
No, it hasn't, in my view. There's countries that have, in fact, single-payer systems that hadn't helped them very much either. The question is, what do we do about rallying the pandemic and treating those who are affected by it? Everyone who's affected by the pandemic is access to free care for anything having to do with that pandemic.